I'm Dr. Joshua Huffman, owner of Mounds View Chiropractic and the author of this book, Growing Young, which is a book that covers natural alternatives to a wide array of health conditions. You're watching this video today because someone you love is struggling with autism. You certainly may be asking yourself, what makes this doctor different from any of the other doctors that we've seen? It's certainly a fair question, and it's one that I actually get asked a lot. You see, I'm a board-eligible chiropractic neurologist, also specializing in functional blood chemistry analysis. My practice is focused on treating adults and children who suffer from chronic neurologic conditions such as autism, ADHD, ADD, migraines, neuropathy, fibromyalgia, and really many other debilitating conditions. Most of my patients, by the time that they've been to my office, have been to multiple specialists, have tried multiple forms of treatment, and oftentimes, unfortunately, have had very little to no results. What makes my recovery program for kids with autism so effective and so unique is that we treat your child, we treat and evaluate your child, both metabolically and neurologically. This is something that nobody else is really doing, okay? And so this is really the key point that I'm gonna stress throughout this video. This unique approach is what I'm gonna spend time explaining in detail, okay? I actually consult with hundreds of doctors across the country on the very treatments that we use in our office for the treatment of autism and these other neurologic and metabolic disorders. Now, before we get started, I just want to personally assure you that in my office, when you come to my office with your child, I can assure you that no stone will be left unturned to determine the exact cause of your child's autism. So please listen close to this video, maybe even listen to it a second time, because I'm going to be sharing life-changing information with you. Now, in beginning to discuss autism, I want to share what I find to be some very staggering statistics. Okay? 1 in 150 children is diagnosed with autism. That's a problem. 1 in 58 boys is on the autism spectrum. 67 children are diagnosed every day. A new disease is diagnosed, a new case is diagnosed almost every 20 minutes. More children will be diagnosed with autism this year than with AIDS, than with diabetes, and then cancer combined. Autism is the fastest growing serious developmental disability in the U.S. The levels are skyrocketing. Autism causes the nation over $35 billion per year, a figure expected to significantly increase in the next decade. Autism receives less than 5% of the research funding of many less prevalent childhood diseases. The boys are 4 times more likely than girls to have autism. 30% of these kids have engaged in theft. 25% will be expelled from high school for misconduct. Now, I can personally guarantee you that no one has told you what I just told you and what I'm about to share with you in this video. I'm going to be addressing, number 1, what makes my program unique? And number 2, how is it that I successfully manage these patients that are dealing with autism? So let's get started with what makes my program unique. First of all, we evaluate both sides of the brain and provide treatment to return proper balance to whichever side is deficient. So let's talk about these 2 different sides of the brain. In order for you to really understand autism and where it comes from, you have to look at the right and left hemispheres of the brain. When we understand what each side normally does for a child when they're in balance, when they're integrated, we can understand what goes wrong with them when there is an imbalance or a functional disconnection. The first thing to understand is what exactly does each side do. The right hemisphere is your brake pedal. It's responsible for your withdrawal responses. It's responsible in stopping movements and stopping thought processes. It's responsible for controlling your gross motor skills, your posture, and your big movements, big arm movements. It likes low frequency stimulation. It's also the where part of the brain, okay? It's involved in social learning, applying proper social etiquette. It's your nonlinear, more creative side of the brain. It's responsible in nonverbal communication, which is very important. So reading eyes and faces. It's stimulated by new things. It's involved in reading, math comprehension, and it's typically considered the sad brain. Now the left hemisphere on the other side is your gas pedal. It's responsible in initiating movement and initiating thoughts. It controls your fine movements, your small movements, your finger function. It likes high frequency stimulation. And it's also considered the what part of the brain, okay? It's rote memorization. It's responsible for rote memorization, for linear thinking, for verbal fluency. It likes routineness, it likes sameness, and it's considered the happy brain. Now, when your brain is out of balance because of a right brain deficiency, which is majority of the times the case, your kids are going to love TV, they're going to love computer use, they're going to love routine. They often have great memory and they're often above average intelligence, but they have very poor social skills and poor verbal skills. That you may find that they throw tantrums and have poor emotional control. And it's because that right brain is not inhibiting that. They may have a tendency to fidget, to constantly be moving, and they have a tendency to fixate or dwell on one thing. These kids often have sensory issues. Why do they develop the language delays? Well, the right hemisphere is responsible for your nonverbal communication, like we mentioned above. Nonverbal communication is really the foundation of verbal communication. Okay, so understanding one's feelings, understanding their facial expressions, their body language, without these basic pillars of communication and understanding, appropriate verbal communication, which is a left brain thing, is often delayed. One method to encourage appropriate speaking in these children is to work on building the foundation, work on building that nonverbal communication. Now, why do these kids develop sensory problems? Sensory problems most often are not a problem with your child's actual sensations or senses. They're often a problem, the problem is often in the frontal lobe and has to do with inappropriate withdrawal responses to normal stimulation. The traditional treatment for these kids and these brain imbalances is medication, okay, which doesn't make sense. These traditional treatments don't take into account this hemispheric imbalance that you have in the brain. You need to know which side of the brain needs the help. Is it the right brain that's weak, or is it the left brain that's weak? What specific areas of each side need stimulation? So do you need help in the parietal lobe or the frontal lobe or the cerebellum? Those are important questions to ask. We also want to know, what is the child's metabolic capacity? When is enough too much? How much stimulation can we give to this brain without exceeding its capacity to strengthen? Now, how do I successfully manage these patients with autism? Well, like I mentioned above, I use specific metabolic and neurologic testing and treatments. So what I want to do now is I want to take some time going over the metabolic tests that we use to evaluate your child with autism.